Hello, everyone. Good evening. My name is Susan Reyna, and I'm here today with Brittany Ward. We represent Beacon Therapeutic. We're a non-for-profit social service organization located in Beverly. I'll apologize. I think my voice is going to be going in and out. I'd like to put a slide up that talks about our website and also our motto. We're empowering lives and changing futures. Of course, you can find us on Facebook and on YouTube. These are 4 different locations. As I mentioned, we're located in the Beverly area. We do provide extensive outreach services throughout the city of Chicago. We have our business office on 103rd. Our homeless outreach services are located on Western Avenue. We have our high school location in Calumet Park, and our Longwood campus is 106th and Longwood, and that houses our elementary program, our Little Intensive Outpatient program, and some of our other programs. I'm the President CEO of Beacon Therapeutic, and I'm particularly happy today to have Brittany Ward with us. Brittany is one of the senior case managers in our CHIPRA program. So maybe, Brittany, before we start talking about CHIPRA and what that exactly is, tell me a little bit about your background and what brought you to Beacon.
Well, I have an extensive background with Beacon. I started to volunteer at Beacon as a high school student. In college, I held a temporary position, so when I graduated, it was kind of a natural transition to start to work for Beacon.
Yeah, well, we've enjoyed having you. We've also enjoyed seeing you grow up.
Yes.
And I think, quick side, I think what's really helpful is that we do very much believe in giving folks an opportunity to volunteer and to contribute. And Brittany, you're a good example of that. And I think it's been great that we've been able then to hire you and to work in the CHIPRA program. So tell me a little bit, what is CHIPRA?
CHIPRA stands for Children's Health Insurance Program Reauthorization Act. The original act was first signed in 1999. It was reauthorized in 2009 with the reforms with President Obama, and that's how our grant came about. The grant was aimed at finding children who don't have health insurance and who are eligible for different state programming, their health insurances, to get them signed up. And that's how we got our grant.
Well, and I think what was so significant for Beacon is that CHIPRA is one of our programs, and I'm just going to put a slide on some of our other programs that we have. And CHIPRA does represent a continuum of services that we offer to our families. We have our day school programs, which Beacon has been most extensively known for. We have an elementary school and a high school. We have a big and little intensive outpatient program. We have a traditional outpatient clinic, our FACT program. We also have an early Head Start program, our shelter outreach services, and then we have an autism initiative. And particularly for our CHIPRA program, it represented the first time we were able to secure health and human service funding, which we are very excited about. So what does CHIPRA do? Tell me a little bit about the team.
For our team, what we do is we help families and teens specifically who don't have health insurance but are eligible for the state's All Kids program. We outreach to them and help provide access to them to the state All Kids program. We outreach to many shelters, community centers. We go everywhere. We go to local land meetings and YRCC meetings to find families and children who are eligible for the program.
Yeah, I put some information on right now on the CHIPRA program. And so just we can go through how we contact folks, and then we can talk more of the detail. So it's a 2-man team, so it's yourself, and then it's Marge Dunn. And there is contact information there, 773-233-3821. And so CHIPRA is a program the goal of the initiative is to enroll children into this program. And this is something... So it's you and Marge, and I'll put a picture of Marge up with some of the forms that we use. And this is a picture of you and Marge, and you were at a workshop or a conference?
Yes, we were at a conference aimed at finding services for homeless students. Mm-hmm. It was about a day service, and we were there. We had a table out, providing information about not only CHIPRA, but the Beacon Therapeutic as a whole.
So what's the eligibility for this program?
Well, for all kids, it's regardless of immigration status. All kids covers children under the age of 19 and their caregivers. There are income guidelines for it. Right now, it's about 300% of the federal poverty level. For a family of 4, the children can be covered, and the parents make about $67,000 a year. For same family, for the parents to be covered, they can make about $44,000 a year. Most people don't know that they're eligible for all kids, but they are. And for more information about that, you can just give us a call at the number listed below.
Okay. I'd like to remind everyone this is a live call-in show, so if anybody has any questions or comments about Beacon or about the CHIPRA program, please feel free to call us. The number is 312-738-1060, and we're here talking to Brittany Ward today, and we're talking about the CHIPRA program. Now, one thing that you just said that's very significant is that immigration status does not impact somebody's eligibility for the program. What does that mean? So a child can be undocumented and be eligible for CHIPRA?
Yes, the child does not have to be a citizen. The parents, however, do, but for children, no documents are required. A child can come and have nothing. We've done an application where there's nothing but the signature page, and the family got approved because it's not required within the state of Illinois.
And
very
so,
unique to the state.
Now, is there any requirement then, and I know that's a big concern right now within the immigrant community, if if they complete any paperwork, will that impact their eventual, perhaps, immigration, at their application to become citizens?
No, not at all. AUKUS does not share information with IDES.
Okay. And so the children then, they can become eligible. Of course, the parents would not be eligible.
Correct.
What type of services does All Kids cover? What are some of the medical benefits that are available?
AUKUS is very extensive. It covers dental, vision, regular medical benefits, mental health benefits also, emergency care visits, transportation costs. So it's a very, very extensive programming. It covers just about everything.
Okay. What about teens, like runaway or homeless teens?
The same services are offered to teens also, and also to the caregivers if they're eligible for all kids.
Who completes the application then on let's say a 17-year-old or 16-year-old that is living on the streets?
An independent teen can complete their own application. If they are at a different address and they can verify, and sometimes we have homeless shelters verify that for us, but most times it's not even needed. But if a teen is independent and does not live at home, they can apply by themselves. Or if they're living with a caregiver or aunt or uncle or grandmother, they can also apply with that caregiver.
And I know one of the things that's unique about the CHIPRA program, and this is one of the reasons I think we got the program funded, I believe Beacon was one of 3 that were awarded in Illinois, and I believe the other one was Chicago Public Schools. It's because we were specifically targeting a highly vulnerable population. So our CHIPRA initiative, the first cycle that we received was targeting homeless families. And now the second cycle that we just received is targeting homeless teens. So what are some of the strategies that we're utilizing to engage homeless teens to enroll them in the CHIPRA program?
Well, part of our program, we've really kind of like looked outside the box and looked at new ways and new strategies to reach teens and family, everyone who's eligible. We've developed certain teen cards, pocket-sized cards that we can give to teens for them to put in their pockets, opposed to big flyers that we know they might not keep and might throw away. And again, just going to different community centers, like going outside the box and going to different resources and not the normal resources that people usually try to reach teens to or reach people to. So, and instead of people going to the office, we always say we bring the office to them in a way to make it a little bit easier, not only for teens who are runaways and who might be not wanting to go to the office or talk to someone about their problems. And we also have that service available for a lot of families who are experiencing economic downfalls and who have lost their jobs. So it's really just kind of thinking outside the box and continuing to.
Well, we're doing a lot with Facebook, right?
Yes, Facebook. We have Facebook. We.
I know you've gone to some of the teen drop-in meetings.
Yeah, we've gone to food shelters. Not food shelters, food banks. We've gone to different shelters, many outreach programs or like events. We worked with a lot of the local council community meetings. So we just continue to try to think outside the box and find ways to meet people.
And now I know we had Marge on, I think, the last season, and one of the things that we were talking about was also the increased number of perhaps unemployed union workers. And those individuals also being able to access this benefit, which is really important. Tell me, has there been one particular anecdote that you can describe, or a particular family, or something that when you were doing this work you realized this is why we're doing this work?
There's a lot of actually events, especially with those families who haven't had to use AUKUS before. It's a program that has been around, but a lot of people don't know about it. They don't know they're eligible for it, and I've had a lot of families who've worked for 20 plus years, and they've lost their jobs, and
I'm going to put some
they ran
pictures
low.
of kids on as you're talking,
Yeah.
because I think it's important. This is what we're talking about.
Yeah, and the parents, they don't know. And a lot of times some people might even be apprehensive to going to the office and asking for help, you know. So we kind of help, you know, get rid of some of those boundaries and barriers to make it easier. And I think that's the best part, kind of help and validate families who don't know they're eligible, and like just kind of relieving some stress off of them, you know.
So they don't have to worry about this.
They don't
now,
have to worry about it.
Now, what if somebody already has a medical bill?
Well, and that's another story. I just recently dealt with a teen who she had a miscarriage, and she had all these huge, crazy bills, like $13,000 worth of bills from a miscarriage. And at this point, she's 19, so she's not eligible. But however, the state, with all kids, they will backdate 3 months.
Oh.
So what I was able to do was the backdate coverage, where the past bills were covered by the state. Yeah.
So you mentioned, so there is an upper age limit then?
There is
so
an
at age
limit.
19, then eligibility ceases?
Yes.
Okay.
Yes. Up until the age of 19. A lot of people have misconception that it ends at 18, but that's not true. It goes to 19. A lot of times we find a lot of teens in the shelter who are 18 and will be 18 for another 6 months, and we sign them up and say, go to the hospital and get whatever you need done. Get it all checked out, get vision, your teeth checked out, whatever you have to do. Take advantage of it while you can, because after 19, especially for males, it's very, very limited services available.
So, and that's, you're speaking of, why is it important for teens to have medical coverage?
It's important for everyone to have medical coverage, and especially because for teens, if they're eligible, because like there's some things they drop off, and if you can get it while you can, it's a great thing to take advantage of. It's important to take charge of your health. That's one of our slogans that we're starting to use now with our new grant, is taking charge of your own health. We've found that a lot of teens, again, that's not their main priority.
Sure.
It's not their main priority, and we want to let them know that, that they should take care of it, especially with them being out in the streets. Sometimes a lot of the homeless teens, and getting tested is also good for them to keep them up. And we know that a lot of them sometimes will go to the ER room and give fake names, and we want to let them know that it's important to establish a health record, a history, so you can have a doctor and develop a relationship with them, so that some of that stigmatism that teens have of being judged is erased.
Well, and I think what you're describing is developing a medical home.
Yes, and a
the
primary
importance
care
of that.
caregiver. Yes.
And I think one of the goals with this initiative overall is having, kids really see, if you do more preventive work up front,
Right.
it'll cost everyone less in the future.
Right.
Both cost the state less in the long term, but as well for the teen, if they're able to address whatever basic healthcare needs they have up front, then long term it's better for their health as well. So you're describing them engaging in a medical home, which is so important, and all the evidence shows that if everyone engages with the medical home provider early on, overall their health outcomes improve, which is so important for the teens. What would you say, particularly with families? Are there some particular challenges with homeless families that they're not accessing some of these resources?
One thing we see with homeless families is them not establishing a medical home, and them going to different doctors and not receiving the care that they could receive, the best care, because you go to one doctor and get a testing done, but the next doctor might not know. So we've seen that, because they might bounce around so much and from different areas, that they might not be in the area where they can reach their old primary care physician, so they kind of just go to the ER room and don't establish that.
And that cost is so significant,
yes.
the ER use. I'd like to remind everyone that this is a live call-in show. The number to call is located on the bottom of your screen. It's 312-738-1060. My name is Susan Reyna, and I'm here today with Brittany Ward, and we represent Beacon Therapeutic. One thing that I wanted to get back to, in terms of re-enrolling, what's changed? Now, you enroll somebody, and then they're on for how long?
A year.
And then what happens at the end of that year?
So the state has moved into a more aggressive re-enrollment process. In the past, kids were kept onto the all kids card once the re-enrollment year ended. Now it's very, 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 very important for families to keep their information with the state current. That means their addresses, their phone numbers, because the state will now drop whole entire families from the medical cards, which with our transient population is very important, because they move around. So again, call us at 773-233-3821 because we do have a hotline number that the state has given us for address changes for those families who might have a hard time, move around a lot.
So that's the importance of connecting with the CHIPRA team, because you have maybe some quicker access to taking care of these things.
Yeah, okay. And we are able to give each case a little bit more attention than a lot of the aid office might have. So we're able to stay on top of those things, make sure things happen.
And I think, what you were saying earlier in terms of you bringing the office to them, and I think so that they complete the application with you, it's avoiding them then having to go to the office and do the application there?
With all kids, they don't have to go to the office to do the application. With some families, depending on the level that they're approved for, they go to the office after they're approved, because they would then be assigned a case manager at their local office. If they are approved for a premium level, then they deal directly with the state in Springfield for their case. But our process, we come out, we do the complete application. We have a portable scanner that allows us to scan documents. We bring our laptops out, so we don't have to go anywhere. If they leave a document, we're at the house, they just run upstairs and get it. They don't have to go to the office and wait hours to get seen. And then once they left something, go back home and come back and wait more.
So that's really important.
Yeah. It saves a lot of time.
It sounds like, it's very flexible too. So
Yes.
you're going into the homes. I know you guys go to the restaurants, you go to the picnics,
You go wherever they're comfortable.
That's what's most important.
Yes.
Now, how large is the team? I know it's yourself and Marge, and you described the undocumented population or immigrant population. Do you have bilingual staff?
We do have a bilingual peer advocate, and we're currently looking for a bilingual caseworker. I think we should be having one coming to us soon, so our team will get bigger, actually, and it's great because we're expanding and we're getting more calls back, so I can't wait for that to happen.
It is important.
It is important, but we currently do have a bilingual peer advocate, and we're going to get a bilingual case manager very soon.
That's great. No, I know that's important, because I think if we're saying we're engaging the population, we need to make sure that we're offering the resources as well. What would you say are some of the biggest challenges with the work that you're doing?
I think the biggest challenges would be, hearing those stories where we can't help, or the stories are like, I think we help to validate people, and I said that before, but hearing the stories of the difficulties that families have had to experience, I've heard families say that they spent their whole savings paying for COBRA or paying for medical bills, not knowing that they're eligible. And it's like, if there was any way that they could have known about the AUKUS program just a month or two before, it would have been a lot easier for them. So I think hearing those stories it's very challenging.
And I think that's what's so, that's hopefully what we're doing today, is making people aware of this benefit and how this is a benefit, available to everybody. All children are covered by this program, and there is an income requirement, but it's not an outrageous income requirement. But it is something that there's other places where you can get enrolled in this, right? I mean, who else? I mentioned Chicago Public Schools. They're usually at the homeschool. There's also somebody there that can help them.
Usually, there's a liaison at each school, but usually it's the receptionist most times.
Okay.
The difference with those programs is our program actually does outreach. So sometimes we might get a referral from a school agency who knows of a family who needs health insurance, but that mom or that parent isn't in a position to come to them and do it themselves. So they'll call us and say, well, I have this family who I know they need insurance, and I've been trying to get her signed up, but she hasn't come out, and she hasn't brought the documents in. So that's when we step in and say, okay, well, we'll come to her. So that the public schools do have liaisons, and they're usually the office staff or office secretary.
But the benefit is, and then they'll refer to us, and then we'll go into the home and do that.
Yes.
Okay. I'm going to put some more pictures of some of our kids up. What additional thoughts do you have, in terms of, you've seen Beacon grow these past 43 years. How do you think Beacon has changed over the past years that you've known us? You haven't been around 43 years, almost. But what would you say in terms of what you've seen Beacon do over the past couple of years since you've been involved with us?
Well, I've seen Beacon diversify in some of its programming a lot, with the CHIPRA team, with the FACT team, with the early head start. And I think that is really, really great, because Beacon, with those programs, is able to provide in-home services to a lot of families, which I think makes it unique in its own way. A lot of agencies don't do that. So I've seen that, and I think that the continued diversification of the Beacon and with these programs is great.
I think what we've looked at over the years, clearly having started as a school and then continuing to identify what are the needs that our families have. And you're right, I think the Early Head Start program at 0 to 3-year-olds. But again, we're targeting, families that are at risk of homelessness or are homeless. The CHIPRA program is one that's specifically targeting homeless and at risk families or teens, which is significant. And of course, the FACT project, we're targeting young homeless families. So I think the goal has always been to continue to develop programs that, where we're providing access to traditional services kind of in a non-traditional way. So you're describing, yes, you have an office, but you're out in the field the whole time.
Yes.
And you're bringing scanners.
We're not asking, we're asking them to, we're coming to them, we're not asking them to come to us all the time. So
which is really
that's
important.
Different,
So this is citywide.
Yes, we don't have, it's more than citywide. Since AUKUS is a state program, we are able to go outside the city limits even. We've been as far north as Evanston. We've been very far west. Marge has even been to Kankakee to do an application.
Oh, wow.
So we do travel a lot. Definitely.
Which I know it's important, again, if you're responding to the needs.
Yes.
So if someone is interested in this, they could call yourself or Marge, and then that number is what, 773
233-3821.
3821, okay. Or they can call Beacon Therapeutic, and I'll put that slide up again at the very beginning, where it talks about our different locations. So you're actually housed at the Western Avenue office, right?
Yes.
Okay. And so then there's where individuals can call and they can access additional information and so on. So what are your final thoughts? Where would you like to see Beacon go into the future?
I would like to see Beacon expand and continue to diversify to meet the needs of Chicago and the issues that surround Chicago. And I really think that with the current economic status of our nation, of our city, of our country, that it's going to be even more important for all social service agencies to do that. I feel like the need for social service agencies is going to get greater. It's going to be in greater demand because people are losing jobs and are at risk for so many different things that is very, very important to have available programming to meet those needs.
Yeah, and I think all of Beacon's programs, there is no fee, or in terms of the school districts fund the school program and some of our grants, and we do Medicaid for some of our services, but we don't turn anybody away based on their inability to pay. And I think the service that we're describing right now, the CHIPRA program, folks don't pay to be enrolled in this. You come out, and that's what the grant funds them. And I think if we talked about some of our other programs, the FACT program and so on, yes, we'll bill Medicaid if that's available, but if not, then we still deliver the services. But you're kind of describing a little bit, or at least I can dovetail into what some of our funding sources are. And we do receive city funding and state funding and federal funding, but we do look for support in different things that we do. And I am going to actually put a quick information on about an upcoming fundraiser that we have. And this is our annual Christmas holiday supper. It's located in Beverly. It's our 19th annual one, actually. And it's always the first Friday in December. It's from 6:30 to 10:30 at our Longwood campus. And it really is quite a lovely event where it's dinner, it's open bar, carriage rides. And if you're interested in coming, you can contact Peggy Rourke. And the numbers here are 773-298-6441. Or you can email Peggy Rourke at p.rourke@beacon-therapeutic.org. But I think that event particularly raises some desperately needed funds. And I know, just before we end real quickly, I know some other things and innovative things that you do in terms of, engaging folks. We provide, kind of goodie bags to help people be involved. And so those are other ways that people can get involved with Beacon.
Yes, the CHIPRA program, actually, we have two different incentives. We offer a gift card for people who are referred in our
So, sorry. Okay, we're kind of running out of time. I would have thought, right?
Yes. Well, we also give goodie bags to the teens who are approved with healthcare-related items, soap, tissue, toothpaste, to help them out.
So, and I think those are the kinds of other ways people can help. So I wanted to thank you very much, Brittany, for coming on today. It was fun. My voice didn't leave. Thank you. And we'll see you again next week, Brittany. Thank you again.
Thank you
for all you do.
Bye.
Bye-bye.